Have you ever had aching eyes, pressure around the face, and then a headache that made you wonder what was really causing it? If yes, you are not alone. The combination of eyes and headache is one of those symptoms that can feel simple, 1 minute and worrying the next. Sometimes it is just eye strain after too much screen time. Sometimes it is part of a migraine. And sometimes, although less commonly, it can be a sign of an eye problem that should not be ignored. In this video, we are going to break it down in a simple, practical way. We will look at who is more likely to notice it, what can cause eye discomfort and headache together, when it may be mild or more urgent, where the pain tends to show up, why the eyes and head are so closely connected, and how to tell when it is time to stop guessing and get checked. Some people feel pressure behind the eyes. Others feel one-sided pain, blurred vision, light sensitivity, redness, or watering. The pattern matters more than the symptom alone. Stay until the end because the final scene covers the red flags you should never brush off. Eye pain and headache together can come from migraine, dry eyes, cluster headache, or glaucoma, among other causes. Before jumping to worst-case scenarios, let's talk about what usually causes eyes and headache together. One very common reason is eye strain. Long hours on screens, poor lighting, not blinking enough, or wearing the wrong prescription can leave the eyes tired and the head aching. Another common cause is migraine. Migraine often brings headache plus light sensitivity, visual changes, nausea, or pain around one eye or one side of the head. Then there are cluster headaches, which are less common but very intense, often causing severe pain around one eye with redness, tearing, or a blocked nose. Dry eyes can also make the eyes feel irritated, sore, and tired enough to trigger or worsen a headache feeling. Who gets this most often? People who work on screens, people with migraine, contact lens users, and those who do not rest their eyes enough. When does it usually happen? Often after long visual effort, exposure to bright light, poor sleep, or during a migraine episode. The key point is this: the same symptom pair can come from very different causes, so the pattern matters. AO and Mayo Clinic both note that headache with eye symptoms can range from common strain and migraine to more serious eye disease. So when is the combination of eyes and headache more likely to be simple eye strain? Usually when the symptoms build gradually after reading, driving, phone scrolling, gaming, or hours at a computer. What does it feel like? Often a dull ache around the eyes, forehead, or temples with tired eyes, blurry focus that improves after rest, and a strong urge to close the eyes for a while. Why does it happen? Because the eye muscles and your attention system get overworked, especially if you are not blinking enough or your vision correction is off. Who is more at risk? People on screens all day, students, drivers, gamers, and anyone using old glasses or no glasses when they need them. How can you respond? Step away from the screen, blink more, improve lighting, hydrate, and make sure your prescription is current. This is also where a simple eye exam can make a surprising difference. But here is the important part. Strain should generally improve with rest. If pain keeps getting worse, comes with severe redness, sudden visual loss, or nausea, that is a different story. AO recommends eye evaluation for unusual vision symptoms, and baseline eye screening is advised even for adults without symptoms as preventive care. Sometimes the real answer behind eyes and headache is not the eyes alone. It may be migraine or another headache disorder. What does that look like? Migraine often causes one-sided or throbbing pain, nausea, light sensitivity, sound sensitivity, and sometimes visual changes like flashes, zigzag lines, or blind spots. Some people describe it as pain behind one eye, even when the eye itself is not the main problem. Cluster headache is different. It is rare, but the pain is often severe, focused around one eye, and may come with tearing, eyelid drooping, redness, or a blocked nose. Who should think about this possibility? People with repeated episodes, light sensitivity, family history of migraine, or attacks that follow a clear pattern. Why does this matter? Because treating migraine is different from treating dry eyes or strain. How can you tell? Migraine and cluster headache often come with a whole symptom pattern, not just tired eyes. Mayo Clinic notes that migraine may include aura and visual symptoms, while NHS materials describe cluster headaches as causing severe pain around one eye with redness and tearing. If you are dealing with eyes and headache, the smartest next step is asking the right 5W1H questions. What exactly do you feel? Dryness, pressure, sharp pain, blurred vision, flashing lights, redness, or watering? When did it start? After screen time? During a migraine pattern, suddenly out of nowhere, or after an eye injury? Where is the pain strongest? Behind one eye, both eyes, the forehead, temple, or all over the head? Who may have extra risk? People with migraine history, eye disease, glaucoma risk, contact lens problems, high screen exposure, or poor sleep. Why might it be happening now? Stress, bright light. And how is the symptom changing, getting better with rest, or getting worse with nausea, halos, blurry vision, or severe pain? Those clues matter a lot. A symptom diary can help you spot patterns and explain them clearly to a doctor or eye specialist. Mayo Clinic specifically recommends headache diaries to understand triggers and track progress, and AO advises prompt attention for unusual eye or vision symptoms. This is the part everyone should hear. Sometimes eyes and headache can point to an eye emergency, and timing matters. What signs should make you act fast? Sudden severe eye pain, a bad headache, blurry vision, halos around lights, nausea, vomiting, sudden loss of vision, or symptoms after trauma or chemical exposure. Why are these so important? Because acute angle closure glaucoma is a true eye emergency and can cause sudden blurred vision, severe eye pain, headache, nausea, vomiting, and halos around lights. Sudden vision loss or unusual vision changes can also signal other serious problems, including stroke or giant cell arteritis in the right situation. Who should be especially cautious? Anyone with sudden onset symptoms, older adults with new headache plus vision changes, or anyone with eye pain that feels intense and out of proportion. How should you respond? Do not wait it out at home. Seek urgent medical or ophthalmology care right away. Mayo Clinic and the AO both describe acute angle closure glaucoma as needing immediate treatment. And AO also warns that headache with vision changes can sometimes reflect serious neurologic disease. So, what is the real takeaway on eyes and headache? The combination is common, but the cause is not always simple. Sometimes it is eye strain. Sometimes it is migraine. Sometimes it is dry eyes, cluster headache, or the wrong glasses. And sometimes, especially when symptoms are sudden and severe, it can be an eye emergency that needs urgent help. The key is to pay attention to the full picture. What do you feel? When does it happen? Where is the pain? Why might it be happening? Who may have risk factors and how is it changing over time? That pattern matters more than guessing based on one symptom alone. Disclaimer, this video is for educational purposes only and is not a substitute for personal medical advice, diagnosis, or treatment. If you have severe eye pain, sudden vision changes, halos around lights, nausea, vomiting, sudden loss of vision, or a rapidly worsening headache, seek urgent medical care right away. And if you found this video helpful, subscribe to the channel, leave a comment, and share your experience or suggestions for future health topics. Your feedback helps create clearer, more useful health content. AO advises urgent evaluation for sudden vision changes, eye pain, or injury-related symptoms.